Good morning, students. All are well now. Study well and take down the notes. Today, I will be dealing with a new topic, that is what teaching. What is what teaching? What teaching is an organized plan of instruction. It is an organized plan of instruction. It is the one of the clinical teaching method. What teaching is the one of the clinical teaching method. Next, we will see the definition of ward teaching. Ward teaching is the teaching of students that is done in the ward, special department, or clinics. Ward teaching is the teaching of the students. This teaching is done in the ward or special department or clinics. Clinics means OPD. Then importance of ward teaching. Next, we will see the importance of ward teaching. The first one is to pass on the skill and knowledge acquired over the years to the students and to help them to become good bedside nurses. It is to pass on. Pass on means to give the skill and knowledge acquired over the years by the teacher. The skill and knowledge acquired over the years by the teacher. This skill and knowledge give to the students and to help them to become good bedside nurses. Then second one, to encourage the students to add their own contribution to the profession. Second one is to encourage the students to add their own contribution to the profession. Next, we will see the principles of ward teaching. What are the principles of ward teaching? The teacher should create an atmosphere where the students can work and learn. In ward teaching, the teacher should create an atmosphere where the students can work and learn. For example, if some ward there is a no time get to do the procedure of the students. Always the staff is giving some their ward work. So the students will not get any time to do their procedure and assignments. The teacher should create an atmosphere where the students can work and learn. The second principle, the teacher should create interest among the students so that they learn with pleasure. The teacher should create the interesting teaching, then only the students will learn with pleasure. Third one is the teacher should not only correct the student but also appreciate and praise her when she does well. For example, in some teachers always scolding the students in the ward. That is the not the correct method. The teacher should correct the students if they are doing wrong, but also the teacher should appreciate and praise the students when the students does well. The fourth principle is it should provide definite teaching about the nursing care of the patient they are assigned. The ward teaching should provide the definite clear teaching about the nursing care of the patient they are assigned. The ward teaching should include individual students' needs, their level of attainment, and area of help needed. It should but teaching should depend upon the students' needs. According to their needs, arrange the word teaching, and then level of attainment and area of help needed. The sixth principle is word teaching correlate with word practice and classroom teaching. For example, teacher is taking one procedure in the classroom. That procedure is teaching the students in the word. There is a relation between the word practice and the classroom teaching. Next, we will see the types of word teaching. What are the types of word teaching? There are two types of word teaching. First one is planned. Planned means classes are prepared well in advance. Then incidental. Incidental means at any time. Next, we will see what are the prerequisites for teaching. First one is formulating the objective. Objectives are formulated by the teacher as well as the students. There are two types of objectives. The objectives formulated by the teacher and by the students. The objectives made by the teachers, it should be clearly stated in terms of understanding, attitudes and skills. The objectives made by the teacher should be clearly stated in terms of understanding, attitudes and skills. Then the objectives made by the students, the objectives are formulated in terms of knowledge, attitude and skill. There are two types of objectives, teacher objectives and students objectives. The teacher objectives should clearly state in terms of understanding, attitudes and skills. The student objectives are formulated in terms of knowledge, attitude and skill. Second one is determine student knowledge. The word teaching should be according to the student knowledge. Then reading materials. The fourth one is teacher should be competent. The teacher should be competent to answer the doubts and questions of the students. Place to teach. There is a place for teaching. Then aviates. For the better understanding, aviates can be used. Aviates should be used. These are the prerequisites for teaching. Formulating objectives, determine student knowledge, reading materials, teacher should be competent, place to teach and aviates. Next is the methods used for teaching. First one is orientation program. Orientation program is a method used for teaching. Then individual or group conference. Through individual or group conference, the word teaching can be done. Then presenting nursing care studies. Presenting the nursing care studies, it is a method of teaching. Demonstration by teacher or experts. If any procedure, that procedure can demonstrated by teacher or any experts. Experts means if the portable X-ray taking, the experts means the X-ray radiographers. Then teaching round by a doctor. By a doctor can do the word teaching. Inviting other resource person from other health sector. For word teaching, inviting other resource person, maybe super specialty doctors or pathology, any other person